Hello, everyone, and welcome to the first session of our Cannabis Learning Collaborative Update, our Spring Learning Collaborative series. My name is Cindy, and I'm with the Higher Education Center, and we're really excited to have you all with us as we explore more about how we as campus professionals can address cannabis use on our campus and provide some updates around the trends that we're seeing in regards to cannabis and how it's being used. Today we have Dr. Jennifer Cadigan from the University of Washington, and she'll be sharing more about her work around evidence-based cannabis prevention and intervention efforts for college students. But before we get started, I'd like to go over a couple of housekeeping things. Dr. Cadigan will be happy to answer some of your questions at the end of her session. And if you have any questions, we encourage you to enter them in the question box on the right-hand side control panel on your screen. And with that, it is my great pleasure to introduce to you Dr. Cadigan. Dr. Cadigan completed her PhD from the University of Missouri and completed her clinical psychology internship at the University of Washington School of Medicine. She's a licensed psychologist and postdoctoral research fellow on an NAAA funded Individual National Research Service Award, an F32, in the Department of Psychiatry and Behavioral Sciences at the University of Washington. Her program of research explores adolescent and young adult health behaviors with an emphasis on the etiology, prevention, and intervention of high-risk substance use, including alcohol and marijuana. This research program integrates evidence-based intervention strategies and the use of technology to address high-risk substance use among diverse populations. This work also examines the association between co-occurring mental health and substance use. Dr. Cadigan, thank you so much for being with us today.
Thank you. Happy to be here. Great. So what I'm going to be talking about today are evidence-based cannabis prevention and intervention efforts for college students. And these are the learning objectives, so gaining knowledge of theoretical approaches, including motivational interviewing. Oops, I'm going the wrong way. Okay. Motivational interviewing, social norms-based interventions, readiness to change, and then I'll describe the development and implementation of some cannabis prevention and intervention efforts for college students. And like Cindy said, I'm happy to answer questions at the end. Okay. Sorry, these slides are clicking in the wrong direction. Okay. So I'm focusing on adolescent and young adulthood because this is the highest risk period for the development of substance use disorders and the development of mental health disorders. Young adulthood is this developmental stage characterized by numerous transitions in relationships, in living situations, in work status, and identity. And this period is really an acute time for the development of mental health disorders. 75% of all mental health disorders present by the age of 24, and high rates of substance use, which can result in altered developmental trajectories. Now, we know that many young adults do engage in heavy alcohol use, and I want to briefly talk about alcohol before we switch to marijuana, just as a comparison. So looking at alcohol, we know that alcohol is an important public health concern, and rates of heavy alcohol use are higher among college students than the general population. So 83% of college students have consumed alcohol in the past year, and college students are more likely to binge drink 5 or more drinks in a sitting compared to young adults. Heavy drinking is also associated with more negative consequences, including impaired academic performance, physical fights, legal and risky sexual behavior, and car crashes involving alcohol are more likely to cause injury or death than crashes without. This is a slide from Monitoring the Future sample, which is a national longitudinal sample. And I show you this as a comparison to marijuana because we're going to look at marijuana in a second. So this is alcohol use trends from 1980 to 2016, comparing alcohol use among full-time students in the red, other individuals who are non-college students, young adults, and then in the blue, 12th graders. And what we see here is that there's this downward trend for all groups. So all groups are using less alcohol. However, college students continue to have the highest prevalence of alcohol use compared to their non-college peers and compared to 12th graders. So now kind of switching to marijuana, we know that 39% of college students have used marijuana in the past year, and I want to contrast that with the 83% who have used alcohol in the past year. Marijuana, as you know, is associated with a host of negative consequences, including impaired driving, interpersonal problems, impaired academic performance, difficulty concentrating, issues with memory. And I briefly want to bring up simultaneous alcohol and marijuana use, and we'll come back to this, but 15% of young adults have used both simultaneously, and this just places them at a greater risk for even more negative consequences. Also, frequent marijuana use is linked to greater depression, greater social anxiety, and some studies have actually shown that there is an increased risk of developing psychotic symptoms among heavy marijuana users. So like I mentioned, 39% of college students do report using marijuana in the past year. And this is, again, a slide from Monitoring the Future data from 1980 to 2016. And what we see here, we can kind of contrast this to that previous slide about alcohol. But what we see here is that there's a similar rate of marijuana use among all of these groups, among full-time college students, among non-college young adults, and among 12th graders. And that was very different to the slide about alcohol use, where college students were endorsing higher rates of alcohol use. And also across kind of the past 10, 15 years, what we see is that the prevalence is slowly increasing for all groups. And now switching back to alcohol, again, as a contrast to marijuana, this is looking at the percent who perceive binge drinking as harmful and among young adults. And what we see here is that 45% of young adults say, yeah, I think binge drinking is harmful. But what we see here is this is a pretty steady rate. There's not a lot of change in the past, I don't know, maybe 30 years, pretty stable. Now, if we look at marijuana, marijuana risk perceptions are quite different from alcohol. So if we contrast with that 45% who kind of stable line thought that binge drinking was harmful, what we see here is that there's this drastic decline in the perceived risk of marijuana use. So people are saying, no, it's not harmful, and we see that kind of trend over the years. And I think one of the reasons why is that marijuana is more acceptable. There are conversations with the legalization, and there's this myth that marijuana is not addictive. So I think all of those things to contribute to this decline in the perceived risk of marijuana use, as it's not thinking that it's not harmful. Okay, so if we go back here, bringing back to why we're focused on marijuana. So this is data from a study looking at what were the top 10 endorsed marijuana consequences among young adults. And we see here the first one is eating, but then we see kind of more severe consequences that could really impact academic performance, such as problems with sleep, problems with being productive, problems with motivation, cognitive problems, memory problems. And you see for a college student, all of these things could be quite problematic and really impact their ability to perform academically. So now thinking about prevention, intervention responses, we kept this spectrum of intervention response ranging from none, where you're not intervening, to severe, where we're having some type of specialized treatment. And the interventions that I'm going to be talking about today are really kind of in that mild to moderate stage, which would be a type of brief intervention would be most appropriate for these people. So these are people The interventions that I'm going to talk about today are for people who are using marijuana. They're having some marijuana-related problems, but they're not at that severe end where they would need a more intensive specialized treatment. This is the stages of change model, and I'm going to briefly address this because I think this is really important in thinking about what stage is somebody in to determine what type of intervention is most salient and most applicable for them. So there's been a lot of research about stages of change and what this means, and I'm just going to briefly summarize. So we can think about stages of change about thinking about where somebody, what somebody's thought process is about if they want to make a change or not. So first we have this pre-contemplation stage, and this is where people are not even, they haven't even begun to think about change. They don't see any need to change, they don't want to change, so they would be in pre-contemplation. Contemplation is the stage where somebody has some ambivalence about change. They're thinking about, well, you know, there are things that I like about marijuana, but then maybe there are some things that I don't like, and maybe I'm starting to think about some of the negative consequences. So it's this ambivalent state where you're starting to kind of think about change. And then preparation is where people have made a commitment to change. So they're thinking about, okay, I need to do something. I need to cut down. What can I do? And the interventions that I'm going to be talking about are really appropriate for people who are in this kind of pre-contemplation, contemplation, preparation stage. And then the action and maintenance stage is when people are actively making a change. And so we can think about this. I'll give you some examples about what this would look like. So if a student says, my marijuana is a problem sometimes, so that would be an example of contemplation. So they're starting to kind of acknowledge, yeah, there are some not so good things about marijuana. I don't think I use marijuana too much. That would be a pre-contemplation stage. So they're not even thinking about change. I'm planning to limit myself to only smoke at parties, right? So that would be preparation. So they're planning ahead, thinking about, okay, these are the times that I want to limit. And then this last one, I enjoy getting high, but sometimes I get high too much. So again, this contemplation, they're thinking about, yeah, I do kind of acknowledge there might be some not so good things. Oh, and this last one, using less marijuana would be pointless for me, is this pre-contemplation stage. They're not even thinking about change. So identifying what stage somebody is in is important because then we can identify what the intervention strategy is. So if somebody is in action, they're already making that change. And so then the question is, how can we then support them to make that change? If they're in this contemplation stage of ambivalence, then it's thinking about, okay, let's talk about the not so good things about marijuana, and there is kind of to resolve some of that ambivalence. And that's what these interventions are going to aim to do. So I'm going to talk about social norms theory for a second and then bring us back to these interventions, because social norms theory is really the primary theoretical model for how we base these brief marijuana interventions off of. And social norms theory basically dictates that our behavior is influenced by what we see around us. Our behavior is influenced by what I think the norm is, and I'm going to act based off of what I think other people are doing, right? And this can be applied to really any type of behavior. And this issue of descriptive norms are this perceptions of what I think other people do, what I think the norm is that other people do. So we know that perceptions of risk for marijuana use are decreasing, right? So that was the Monitoring the Future data showing that, yeah, I don't think marijuana is that harmful, and that is decreasing, while the normative perceptions of use are increasing. So what that means is more and more people are thinking, yeah, I think a lot of other people use marijuana, and I don't think it's that harmful. And as we'll see, neither of those things are actually true. So college students do misperceive the rates at which their peers use marijuana. People who are estimating that others use more, those people are more likely to then engage in heavier marijuana use themselves. So our behavior is strongly influenced by these perceived norms. And one mechanism that I mentioned for behavior change is actually receiving normative feedback, which corrects these normative misperceptions. So you're correcting the discrepancy between how much I think others use, how much I use, and how much others actually use. So this is just one example, and I just made up these numbers here, but this is an example of what this feedback would look like, where somebody would be given feedback about how many hours high are you, and they would get information about that yellow line. This is your use. That purple in the middle, this is what you think other people's behavior is. And here's what the actual use is. And essentially what this does is it's showing people, one is that others are not using nearly as much as you thought. And you're actually using more than the average, right? So it's telling people, yeah, other people are using marijuana, sure, but they're not using nearly as much as you think they are. So it's correcting that normative misperception of use. And this is just one example. This data is, it's old data, but I think the point is still well made, and the numbers are actually quite similar to today. So this is a survey of about 6,000 participants. 68% of students said they hadn't used marijuana in the past year. So we would say, okay, well, most students don't use marijuana, but only 2% of students actually got that right. And I'll show you what that looked like. So what it looks like is this. So on the left is the perceived use, and then on the left is actual use, and on the right is perceived use. So what we find is that actually 56% said I never used marijuana in the past year. And then on the right, only 2% thought that. So that is quite a difference between the actual use and the perceived use. So I'm going to now switch and talk more about what these brief interventions actually look like. So all of these brief interventions for marijuana use have these 5 main components. So the first is, so these are all personalized brief interventions for marijuana use. So the first component is that they all give information on personalized use and normative comparisons, and that was those figures that I just mentioned. So people are getting feedback on, this is how much you use, this is how much the quantity of use, this is the frequency of how much you use, and the normative comparison, this is how much you think other people use. But actually we found this is people, so it's the perceived use, but then actually how much are other people using? So it's those 3 pieces of information in order to essentially generate a discrepancy between what I think other people are using and what they're actually using. And so again, taking home that message of, yeah, people are using marijuana, but they are not using nearly as much as you think they are. And you are actually using more than most people. So then they get information on personalized consequences related to marijuana use. So they would fill out a survey and tell us what negative marijuana consequences they're experiencing, and then they're given that information. These are the negative things about marijuana you told us. They get financial info about how much money they're spending on marijuana. And typically these interventions include another piece of personalized information to them, whether it's personalized family history, risk of dependence, or other reasons for using marijuana. And then they also conclude with some strategies for reducing use. And I'm going to show you an example of what this would actually look like. So we know that these personalized normative intervention approaches are effective at reducing marijuana use and consequences in the short term. And I just pulled a couple citations here. So these are all web-based brief personalized interventions for marijuana use using the Marijuana e-Checkup to Go, which was also referred to as the e-toke. And the Marijuana e-Checkup to Go was developed at San Diego State University. And you can see here there's a couple studies that have looked at the effects of this intervention. And all of this intervention, so like I mentioned, it is a web-based intervention. So people would receive their personalized information over the computer. And that personalized information would include detailed personalized feedback about their marijuana use, including how much they're using, normative comparison to other students, consequences of marijuana use. And most of these studies have found that these interventions do reduce the descriptive norms, so they're able to correct these normative perceptions. So at the end of the study, at follow-ups, people who receive the intervention do say, yeah, not everybody is using marijuana, and those normative misperceptions are corrected. And there are some effects that these interventions do reduce marijuana use and consequences at a short-term follow-up. These interventions have also, there have been other types of personalized normative interventions, other web-based interventions that also include this personalized normative feedback. And then there's also an in-person intervention, which was developed here at the University of Washington by my colleague, Christine Lee. And I'm going to describe more about what that in-person intervention actually looks like. So the in-person strategies for a marijuana intervention typically include a brief motivational intervention and motivational interviewing in conjunction with the personalized feedback information. So what this looks like is that these type of motivational interventions are non-judgmental, they're non-confrontational. We're not telling people, I think you need to change, I think you're using too much marijuana, but rather we're meeting people where they are and having a conversation with them about their use. And the goal is to elicit personally relevant reasons about why the student wants to change. Not, I'm telling you I think you need to change, but let's talk about this. What are the good things about marijuana? What are the not so good things about marijuana? So then you, student, can kind of come up with those reasons about what you want to do with your use. One of the things that always comes up in these interventions is resistance from the students. And I think it's important for the facilitator to be mindful that resistance is expected and it's normal. And if you're getting resistance, I think it's important not to turn this into an argument between you and the student, but rather to just change your strategy and not kind of go down this line of us versus them, but rather it's a collaborative approach together. And so these interventions, there's a couple main goals I want to mention. One is thinking about when there are signs of potential risk or harm, that's when the key is to provide this early intervention. And that relates to that previous slide about the spectrum of intervention response, when there is kind of this mild to medium level of risk to do this brief intervention. And then if ultimately in line with what motivates the individual, you as the facilitator are prompting contemplation of change. Or prompting a commitment to change or action. If the student is saying, these are the changes I want to make, then it's you as the provider, how can I support you in making those changes? And like I mentioned before, we're exploring behavior change strategies and discuss skills to reduce harm. And so, go back a slide. These are, I'm briefly going to mention these four main principles in motivational interviewing. And like I mentioned, these are the in-person sessions. So the first one is to express empathy. And this sounds like such a basic skill, but it's so incredibly important. Just showing that you're there in the room with the student and you care about them. That is incredibly important. And again, not coming from this judgmental, I want you to change, you're using too much, but rather expressing genuine concern for the student, that you care about them, and you want to, the goal is to have a conversation with them about their use. And then the next is to develop a discrepancy between their values and goals for the future in contrast to the status quo now. And so this is really important. And what this looks like is this this change talk would be in line with the contemplation stage of change, right? So these kind of examples would be if a student tells you, College is important to me, but sometimes I get high before class. So it's those but statements, right? So college is important to me. So that's the value. I want to do well. Academics are important, but this is how my marijuana interferes with that goal. So that's a great statement to develop this discrepancy between what my goals are for the future and how does marijuana impact those goals. So another example of this kind of discrepancy is, I smoke with my friends, but sometimes I have a hard time concentrating after and I can't do my homework, right? So this goal of my friends are important, school's important, and at the same time, when I'm using marijuana, I'm not able to accomplish the things that I want to accomplish. So those are what those discrepancy statements look like. The next one is just rolling with resistance, this idea that we don't want this to be an argument of you versus the student. We're not labeling the student. We're not, again, saying, I think you have a problem, but rather the point of these interventions is really to just have a discussion with the student about what are these things that are important to you, what are these goals that are important to you, and how does marijuana impact those goals? And then the supporting the self-efficacy of the student, right? So the students that we're working with, they're ultimately responsible for choosing and implementing change. So if a student wants to make a change, great, how can we support you with that? If they don't want to make a change, then it's talking again about how does marijuana fit with these goals, and moving people, if they can move from a pre-contemplation to a contemplation stage where they're starting to think about maybe what are some of these not so good things about marijuana use. And so what this would look like is eliciting these change talk statements from the student. And these are self-motivational statements that the student makes. So again, we're not telling them you need to stop using, you need to make a change, but it's having this conversation about what are the good things, what are the not so good things about marijuana, so that the student can then make the argument for change, right? So what this would look like is a student saying, sometimes when I get high, I have problems with my sleep, right? So the student is recognizing, yeah, there are these problems. Sometimes when I get high, I don't get done what I need to do. Another example is a student saying, right, like, I like getting high, but I don't want to get high before I have a test. So again, this value of school is important to me, contrasting that with their use. Being high lets me escape from reality, but maybe I should be more present. It's these but statements that the student's making to voice, maybe there is some problem recognition here. And then you as the facilitator following up with that about, tell me more about that. What's that like for you? These open-ended questions where you're really opening the door to start having a conversation with them about their use. And what some of these open-ended questions are, I think these are just some nice examples about, what do you make of this? Where do you want to go with this now? Tell me more about this. And these are all approaches to help the students examine and resolve their own ambivalence. So again, I'm not telling you what I think you should do, but I'm asking you, you told me that you like to smoke, but then you're telling me that it really impacts your sleep. What do you make of that? And having the participant kind of guide what they make of that. And so one intervention that this was used was this study by my colleagues here at the University of Washington that was published in 2013. And this was a in-person intervention, a personalized feedback intervention that was with an in-person component. So the facilitator was meeting with students, was reviewing their personalized feedback, and was using these motivational interviewing strategies with them. Okay, so participants for this study, these were from 2 public universities and colleges. In order to be in the study, participants reported 5 or more days of marijuana use in the past month. We had a total of 212 participants. As you can see, about half were female, the majority were white. And this is the study flow. So participants completed a screening or baseline, and then they were randomized to an intervention or a control condition. They completed the in-person personalized feedback intervention for those in that condition, and then they were followed up at 3 and at 6 months. So this is an example of what the intervention actually looked like. So again, this is that personalized feedback, which would also, variation of this was also used in those other web-based interventions that I previously talked about, where people are given a printout of their personalized feedback about their marijuana use. So in those other web-based studies that I mentioned, the marijuana e-checkup to go, this information would have been delivered electronically to the student, so they would have seen it in their, they would have seen it on a web page. But this intervention was an in-person intervention. So a facilitator was there with the student, reviewing this feedback and using those motivational interviewing strategies that I previously mentioned. So an example of this is the facilitator would sit down with the student and would basically just talk about this personalized feedback. So the facilitator would use those motivational interviewing strategies to create and resolve ambivalence about marijuana use using open-ended questions. So the facilitator might say, during the past 60 days, you used marijuana on 47 days. What do you think about that? What stands out to you on this page? Does anything surprise you on this page, right? So it's not this, it's a non-judgmental approach. It's not, wow, you're using marijuana a lot. You really need to stop. But instead, it's pointing out that this is the information that you told us. What do you think about this? What stands out about this? So it's starting a conversation about marijuana use. So the next page of the feedback would be something like this, where people are given information about those norms perceptions. So for this example, people were asked, what percent do you think of students did not use marijuana in the past year? So the facilitator would show people, you thought more students were using marijuana, but we actually found that it's less students than you thought. What do you think about this? Right? And so they're helping the student realize that their normative perceptions, what I think others are using, is actually less than I thought, right? So this idea of, wow, actually everybody's not using marijuana all the time. And this is incredibly important when you tie this back to social norms theory. And then also they're given information about what are some of the reasons that you told us that you're using marijuana. And so just more of what this feedback looks like. They would be shown, these are some of the consequences you endorsed about marijuana use. And again, from the facilitator using those motivational interviewing strategies, it's, on the one hand, you're telling me that you really like marijuana, but then on the other hand, you're telling me that marijuana reduced your ability to concentrate. Tell me about that. What do you make of that? Again, opening the door to have a conversation with the student. So here is more of the personalized feedback. So there would be given feedback about how much money did they spend on marijuana. And again, from the facilitator's perspective, it's what do you make of this? How does this fit with your overall financial goals? And then the student was given feedback about, these are the things that you think would happen if you cut back on your marijuana use. So for example, this student said, I would be able to think more clearly if I cut back. So then from the facilitator using those motivational interviewing strategies, it's, tell me about that. What do you make about that? Trying to resolve some of that ambivalence with the student. And this is just more information about, the student is provided with personalized feedback about reducing use or quitting marijuana, family history, and then the last part is they're given feedback on their social network and then their goals about how does marijuana impact those goals. Okay, so for this intervention, what we found is that at a 3-month follow-up, individuals who were in those intervention condition reported 24% fewer joints smoked per week relative to the control condition. And then we also found that those intervention participants reported 21% fewer hours high compared to the control condition. So this is really promising results that these kind of in-person personalized feedback strategies are impacting behavior. And there's a couple mechanisms about why we think these interventions work. Both the in-person intervention that I previously described, but also just the web-based intervention where people are just receiving that personalized feedback. And one of the main mechanisms of change is this correction of misperceived norms, right? So this correction of, I realize now that everybody is actually not using marijuana. Yeah, some people are, but most people are not using nearly as much as I thought. And it's challenging those beliefs about how much other people actually use. And these other two mechanisms of change about a student being ready to change or problem distress, I think relate to the motivation to change, stages of change that we previously talked about. So we know that these marijuana norms-based interventions are effective when participants at baseline are telling us that they have some motivation to change. So at baseline, if students are in this contemplation stage, so this stage of, yeah, there are some things I like about marijuana, but there's also some things that I don't like. And I'm in this kind of ambivalence about stage, or I'm in preparation where I'm thinking like, yeah, I think I do need to cut down. People who are in those stages had significantly fewer days of marijuana use at a follow-up than those in the control condition. So then the question is, if a student is not in that stage, if they are in that pre-contemplation stage where they're not even thinking about change, then the purpose of the intervention is using those motivational interviewing strategies to move them into that contemplation stage, to move them into that stage of, well, yeah, maybe there is some ambivalence about use here, or maybe, yeah, this one thing about use I actually don't like. And just to reiterate here, this interventions work for people who have more problem distress at baseline. And so this is kind of to what extent people are bothered by marijuana consequences. So if people have more distress at baseline about their marijuana use, they're probably in that contemplation stage. They're probably thinking about those not so good effects. And those people had less marijuana related problems at a follow-up. I briefly want to talk about event-specific interventions, especially related to marijuana use. So there's been a lot of work in the alcohol field about what are event-specific interventions for alcohol use. So what are these times of, whether it's a holiday, it's a birthday, a special occasion where we know that there's going to be more use. And for alcohol, that's, you can imagine 21st birthdays, it's spring break, it's Halloween, it's New Year's Eve. And as you can imagine, for marijuana, it's 420. And so there's been empirical studies showing that people actually, yeah, they do use more on 420. They do have more negative consequences related to marijuana use on 420 than are on other days. And what's interesting about these kind of specific events, like, again, this special occasion, is that they're time limited and they're anticipated. So we know that 420 is only going to last for one day. We can anticipate it the day before, so we can identify these heightened areas of risk to intervene ahead of time. And 420, I think, is just kind of the classic example, but I think it's worthwhile in thinking about, especially with marijuana, what are these other heightened risk periods that, whether they are a holiday or a birthday or another kind of special occasion unique maybe to your own campus, that is associated with more marijuana use. Okay, so I think there's several ways to think about how to improve our intervention programs. One is making sure that we have accurate norms. Like I mentioned, the main mechanism of change is correcting these normative misperceptions. It's showing people data from a large sample that people actually don't use as much marijuana as you thought they did. To address the also the risk perception that more people are thinking marijuana is not harmful. I think it's important to address that in intervention programs. And also this idea of functional impairment of marijuana use. So how does marijuana use negatively impact my friendships, my relationships, my ability to do well at work or at school? And then finding this discrepancy between the use and those values, right? So school's important to me, school's a value, And then that discrepancy when the student says, like, yeah, I like to use marijuana, but when I use, I can't focus as well at school. So it's this discrepancy between what's important to me, what are my goals, and how does my use impact my ability to do those things that I want to do. And then simultaneous marijuana use and consequence. Simultaneous marijuana use and alcohol use. People who are using both, I mentioned this previously, but they are at a greater risk of all of those negative consequences that we've discussed. They're especially at a greater risk of having impaired driving. So I think it's important for interventions to also target not just marijuana alone, not just alcohol alone, but what about those times that you are going to use both together? Because we have found that about 15% of young adults in the past year will use both of these substances at the same time. And again, just to reiterate this discrepancy between use and values, right? So how does my use fit with my goals? Well, my goal is I want to graduate from college. My goal is my job is important to me. So then it's, okay, how does marijuana fit with that? Asking those questions in an open-ended, non-confrontational, non-judgmental way. And we actually are in the process of this paper that we've been working on is we asked young adults, what are some of these decision points that for limiting marijuana use? And what we found is that young adults report really specific reasons for limiting their marijuana use, which I think could be easily incorporated into prevention or intervention efforts, right? So people said, well, yeah, I would limit my marijuana use when it interferes with school, right? Or I limit my marijuana use because I don't want it to interfere with my work or my relationship. Or if I have like safety concerns. So people had very kind of clear guidelines in their head ahead of time about what are these times when I am not going to use as much marijuana. So I think eliciting these reasons for students wanting to reduce marijuana could be incorporated into these marijuana interventions. If it was an in-person intervention, it could be consistent with this motivational interviewing style about, tell me about how does marijuana impact your work, or why would you want to not use marijuana before work? Why would you not want to use it if it impacts with school? Again, that discrepancy between the goal, the value, what's important, and how does marijuana impact that? So I briefly mentioned simultaneous alcohol use, but I want to revisit this because I think this is an important topic moving forward, and the field is just there's a lot of research kind of coming out now starting to look at this. But compared to using alcohol or marijuana alone, simultaneous use, so the use of both substances, is associated with increased negative consequences, including more impaired physiological and cognitive effects. There's been a lot of data showing there's greater rates of traffic collisions among people who have used both substances compared to just using alcohol and driving or just using marijuana and driving. There's greater harms associated with social relationships and with employment. And then what we also have found is that people who do use simultaneous use, they do report a greater use frequency of alcohol and or marijuana. So basically what that means is that the students who are using simultaneous use, in addition to just using both at the same time, they're also heavier drinkers and they're more likely to be heavier marijuana users. So I think it's really important on campus or if you're meeting with students to also assess for the simultaneous marijuana and alcohol use, just because it is associated with greater rates of risk of harm and greater rates of negative consequences. Okay, so when we think about what are some of the guidelines for moderate or low risk marijuana use, I think this is a really interesting topic to think about because with alcohol, there are a lot of guidelines for low risk alcohol use. So we have one is just the legal limit of 0.08. We have information about binge drinking, so drinking four or more drinks or 5 or more drinks, four or more drinks for women, 5 or more drinks for men in a sitting. And we can tell people that we know that if you're going to binge drink, you're more likely to experience more negative consequences related to alcohol. We know that people at BAC of 0.06 or more are more likely to start feeling the kind of negative and depressant effects of alcohol. But it's different with marijuana. And we don't necessarily have those same guidelines about moderate or low risk marijuana use like we do for alcohol, right? So we don't have a kind of binge drinking equivalent for marijuana. We don't have like a binge marijuana guideline that we can tell people. So then we have to think about, if you're meeting with the student, what are some guidelines for this moderate or low risk use? And this is a paper that recently came out in the American Journal of Public Health, this Fisher 2017 paper, and they proposed 10 guidelines. And so the first one is abstinent, right? So if you don't want to have any risk, well, don't use, okay? And then this avoiding early initiation, so before the years of 16, okay, not as helpful for people on college campuses. But I think what are helpful for college students to know is this idea of, if you are going to use marijuana, how can you use in a way that you're going to have less harms associated with use. So one might be using a low potency THC or a balanced THC to CBD ratio. That number 3 there. Number 4, abstaining from synthetic cannabinoids. So those would be like abstaining from spice or K2. These non-smoking methods, so using it in a different way. If you are going to use, don't use it as a deep or risky inhalation. And then number 7, avoiding high frequency use, right? So if you are going to use, can you try not to use every day? Can you use once a week? Can you use, thinking about how to place limits maybe on the frequency of use? And then number 8, abstaining from driving. I think this is also tricky. In the article, they suggested waiting 6 hours after use, but of course that can vary based off of how much marijuana you use, what the THC content is. And then number 9, if you're at a higher risk, just avoid completely. And that higher risk would be if you have a certain predisposition or a family history of a psychotic disorder or a substance use disorder, or you're pregnant, to just avoid it completely. And then that last one is avoid combining the above behaviors, right? So if you are have an early onset of use, and then you're using daily use, you're just going to have a greater risk for more problems. But I think this is a really important topic, thinking about as we move forward about what can we actually tell students for some moderate or low risk marijuana use if the student does want to continue their use. If they want to be abstinent, great, we can help give them tools and strategies to support that abstinence. But if they want to use, how can they use in a way that is associated with less harms? All right, so thank you, and I want to thank my colleague Christine Lee for sharing some of her slides with me as well. So I guess we can turn it over to Cindy.
Yes, thank you so much, Dr. Cadigan, for sharing your presentation with us. Particularly, I thought the list that you just went over around low risk and moderate risk guidelines is helpful to a lot of us. This is the time to ask questions, and so we encourage you to enter those questions into the question box on the right-hand side. We already have a few questions coming in, but as we wait for some of those questions, I have a couple of additional housekeeping things. As part of the Cannabis Learning Collaborative update, you have access not only to the live webinars as they happen, but their recordings. You should have all received directions for logging into our portal, allowing you to view those recordings. And so here you can see, if you go to our website, hecaod.osu.edu, and click on the member login button, that'll take you to the place where you can enter your username and password so that you can access those recordings. And our next webinar is taking place next Thursday. And it features Dr. Tavis Glassman from the University of Toledo, and he'll be discussing his work around health communication strategies to address cannabis use. And so, Dr. Cadigan, I have a question for you. What if students don't see any negative consequences relating to academics? What would you advise campus professionals to say in that situation?
Mm-hmm. Well, one thing is, I think a lot of people who do use marijuana report problems related to sleep, and they may not recognize that as a problem. So I would stress to think about what are some of these other areas where you are negatively impacted by marijuana. So maybe it is sleep, and then tying the sleep into school that way. More people will, I think we did a recent study and about 75% of students did report sleep issues related to marijuana. So I think going down that avenue, I think is helpful. And if they don't report any, then I think it's thinking about what are these other values that are important to them. So maybe school just is not important to them, but maybe there are these other things in their life that's important that marijuana is interfering with. So maybe that is sleep, maybe that is something like a relationship, or maybe instead of school, it's just thinking about the job and what do you want in the future? What job would you want in the future? And tying it back into kind of marijuana use in the moment, impacting those longer term goals for the future.
Great, thank you. What about social norms marketing campaigns for marijuana? Are you familiar with any studies evaluating the impact of those?
Yeah, I'm more familiar with the alcohol social norm campaigns, but I think the key is when you are doing the social norm campaign is to making sure that the norms you have are accurate and from a large sample. So large sample, like thousands and thousands of students. Part of also with the social norms campaign is making sure, and you can't necessarily do this with the campaign, but it's being able to tell people this is how much you thought other people used. And sometimes with the social norm campaign, right, it's just the average student thought, so it's not as personalized to them. So the more that you can personalize these interventions to the student, the more that the students are engaged. So I think if you could elicit a conversation in your office with the student about how much do you think other people use, and then tying it back to this is the data that we actually found on campus, I think that can make it more relevant for the student to get them involved.
Great, thank you. And what about those students who are in that pre-contemplation stage, but just don't seem interested at all in changing their behavior? What kind of recommendations do you have for campus professionals working with those students?
Mm-hmm. Yeah. So I think when you're working with these people who are in this pre-contemplation where they haven't even thought about making a change. One of the things is it's important to not then give them a list of, well, here's a bunch of resources on campus and here's a bunch of strategies you can do to cut down, right? Because they just told you, I'm not even thinking about cutting down my use. So it would be inappropriate to kind of throw them a list of resources because they're not gonna they're just not in that stage at all. So I think with those people, then it's having this conversation using, if it was an in-person intervention, it's using those motivational interviewing strategies to move them from this pre-contemplation to contemplation. So asking those open-ended questions about if this was like a personalized feedback intervention, they would have previously told you these are the negative consequences of marijuana use. And most people will check at least one negative consequence of marijuana use. Like I mentioned, sleep is very popular. Most people will report some type of sleep issues. So then it's really having a conversation about, you told me that you like marijuana and you like using, but then you also told me that it impacts your sleep. Tell me about that. And so it's kind of finding that one hook, the one thing that they might have some problem recognition for, and having that kind of open-ended question about, tell me how it impacts your sleep. What do you think about that? How does it impact? So if your sleep is not great, how does that impact the next day? What do you do the next day? And they're probably going to then say, well, maybe I don't get as much done the next day. But it's kind of finding what's that one maybe hook for them, any type of problem recognition that they might have. And like I said, sleep is a pretty good one to target, because most of the time people will endorse using marijuana to either help with their sleep or sleep issues related to marijuana use.
Great.
And I think also, I'm just going to add one more thing. If they are in that pre-contemplation stage, I think it is also, we want to help them move into contemplation. We want to help them get into the stage of ambivalence where they do see some of those negative impacts of marijuana. But also, if the student doesn't want to change, it's also supporting their self-efficacy about saying, like, well, at this time, you're okay with your use and you're okay using in this pattern. And it's kind of being okay that maybe they don't want to change right now.
Great, thank you. There was a recently accepted article by Lyndon Carmichael and colleagues that looked at co-users of alcohol and marijuana and the limited effectiveness of brief motivational interviewing, as the impact of consequences has less of a motivator on their decisions. Did you look at all at co-users versus students who may use marijuana or alcohol independently and the difference between those two groups?
Let me just repeat back what I think. So differences in negative consequences between maybe simultaneous marijuana and alcohol users compared to alcohol alone or marijuana alone?
I think maybe the question might be looking more at is there a difference in intervention efficacy between groups of students who maybe are co-using versus only using marijuana, I think.
Oh, interesting. Okay. Sure. So what I think, it's so funny, I actually have that article saved that the person who asked that question. Well, one of the things is I think that study is a really important first step in looking at co-users and thinking about how can we intervene with those people. The other difference I want to just point out is that the Lyndon Carmichael article looked at co-users, which are different than simultaneous users. I think they defined it a little bit differently. So simultaneous users are using both at the same time. And I think this article defined co-users as kind of using one or the other. I might be mistaken about that. Yes. But I do think, yeah, I'd have to read that article in more detail. I do have that saved to kind of comment more about that.
Okay. We have just a couple more questions I think we'll have time for. One is around their campus implements K6 as a brief intervention. And they are curious what you suggest we do for students that are not involved in these brief interventions, but they are still wanting to get more cannabis programming and interventions out to their campus community. Do you have any suggestions for campuses who may be in a situation like that?
Right. So I think number one is the social norms approaches and having students using those campaigns about telling students, yes, people are using marijuana, but it's not nearly as much as you think. That's incredibly important. I think it's also talking about the dangers of dispelling the myths that marijuana is not addictive. I think that's incredibly important. And there is this kind of, misperception of these misperceptions that marijuana is not harmful and that marijuana is not addictive. So I think it's important about telling students that those things are actually not true, and talking more about the harms, especially related to driving. And then lastly, I think some of these intervention strategies for low risk marijuana use. If you do want to use marijuana, how can you use in a way that is associated with less harm, and what might some of these strategies for low risk marijuana, what might those be, and how could you as a student actually implement those?
Great. And this is our final question for you. We may engage with students who are sharing false information about cannabis, but do you have any recommendations for techniques for how we might have conversations with faculty and staff who may be
Mm,
sharing false information about cannabis use.
yeah. Oh, that's interesting. Um, well, I'm going to assume that maybe the false information is that I think again, if the false information is related to the like, there's no harm associated, marijuana can't be addictive, and it's dispelling those myths. And I guess those might be important conversations to have with faculty as well. But I do think it's also important for faculty to be aware of these norms too, so that I think sometimes faculty have this misperception also that all of my students on campus are using. And again, that is not true. Yeah, some people are using, but all of the students are not using. Um, so I think to convey that information to faculty as well, because it will sometimes trickle down from faculty to students.
All right, great. Well, Dr. Cadigan, thank you so much for being with us today. We really appreciate you giving your time and sharing your expertise. Additionally, we want to remind everyone about our upcoming national meeting that'll be taking place July 29th through August 1st that brings together campus professionals working across the continuum of substance misuse from prevention all the way to collegiate recovery. You can learn more about that conference at the web address that you see below. Dr. Cadigan, thanks one more time to you. We appreciate you giving your time, and we look forward to seeing all of you next week as we explore our second session of the Cannabis Learning Collaborative update.
Thank you.